Welcome everyone to this webinar on how to schedule like a multi-million-dollar practice. We're super excited to discuss this highly important topic with all of you today. And we hope to share some great strategies and help you really take that next step. And everyone's at different levels with their practice. So whatever that next step is for you, we want to help you get there. I am your guide today, Neil Kotari, the Chief Operating Officer of PracticeWeb, and I'm delighted to spend this hour with you, and I really appreciate you spending the time with us. Now, as a quick background about PracticeWeb, who we are, for those of you who are using PracticeWeb, you will know some of this, but we are an industry-leading practice management software since 1994, so we've been in the industry for a very long time. We help solo to multi-location practices, as well as generalists and specialists thrive. That is our motto, to help you thrive. And we are an all-in-one practice management solution. So on today's webinar, you may see glimpses of that as we discuss different tools and strategies that you can use to schedule more efficiently and more effectively. Now, if you're watching this on YouTube, please do go ahead and like the video, subscribe to our YouTube channel, PracticeWeb. And we have great content every month, every week getting shared there. And then also click that bell icon to get notified of any new videos that we put out. So number one, we're going to definitely talk about how important it is to schedule effectively and all the different ways it affects the practice, from patient happiness to production to team morale. Then we're going to get into the nitty gritty, the strategy. So one thing I'll say about the strategies is that I can almost guarantee that all of you are doing probably at least one of the things we're going to talk about today. I can almost also guarantee that probably almost no one is doing everything we're going to talk about today. That means you'll hear some things that you're already doing, which is great. Maybe you'll learn how to refine that. And you're also going to learn things that you're not doing, or maybe you know about it, but you should be doing and you're not doing. So that's the great thing here. Now, the first thing is ideal procedure times. Secondly is production targets. Third, and I'm talking about the strategies here, is maximizing production and preventing chaotic scheduling. Then filling your schedule with the different options and campaigns, and then keeping your schedule full, and how to kind of deal with those last minute cancels and having backup plan. So that is our outline. Now, just to give you a glimpse, some of the tools and resources recommended, if not required, would be, hey, have a system like PracticeWeb to really, that's the hub of all of this scheduling. Then, timer, a clock, calculator, that's going to be related to the procedure times. We're going to recommend at some point that having multiple chairs per dentist, 2 to 3 is recommended. Having at least one assistant per dentist chair. Having some reminder automation software like our own PW Connect texting solution and email solution. And then teamwork. Of course, every office is different, and we need to work together and get to that perfect day and get to that promised land. Additional tools we're going to cover at some point is online scheduling, teledentistry, and as I mentioned, automated reminder systems for the schedule. First thing is that scheduling is the heart of your practice. I don't really need to tell anyone that, but let's put some color to that statement. So there's a famous quote, either you run the day or the day runs you. So we want to help you run the day. And sometimes it feels like the day is running you. You look back, at the end of the day, and every business owner, every, person who's involved in this kind of operation feels like this at some point. The day has just run me over. So let's try to get in control. So a lot of people are probably wondering, how are other dental offices doing? So there's some great studies and surveys that the ADA, the American Dental Association, does very often. This is very recent data from as of September 2022. We can see they survey thousands of dental practices, and it's been pretty steady over the last, I would say, 6 months, hovering around 86% of how full a practice schedule is on average. So of course, if you are, let's say 95%, you're doing better than average. If you're, let's say, at 50%, you're doing below average. But this is kind of what things are looking like out there. Another aspect is, we all have the same challenges. There's a question asked in the same survey about what factors prevented your schedule from becoming full, and the biggest one by far was, and select all that apply. That means like they could have picked any one of these together. And the biggest one was the no-shows and cancels under 24 hours. And then cancellations after 24 hours is the next, because obviously that gives you a little bit of time to fill it. But those are cancellations are just the pain right there, right, for everyone. And then, however, number 3 here is almost as much as, like, I would say actually even more than patient cancellations with 24 hours notice is not enough patients making appointments. So figuring out ways to provide that care to patients who need it, convincing them to come in. And then the last 2, I think staffing has been an issue ever since we came out of the pandemic. It's been an issue. And then lastly is COVID, but that has become less and less of a distraction in terms of safety protocols. It's just been something that's now accepted, and we have a kind of a streamlined system for most of the time. Now, scheduling. So now we see what's happening out there, but there are strategies that impact production. And it's just a preview. We're going to cover a lot of these, but for example, just to give you an idea of how strategies can help, if you just go from a dentist on 1 chair to 2 chairs, that's a huge gain. If you go from 2 chairs to 3 chairs, that's another gain. And there's always obviously a sweet spot, but that's one strategy that we're going to talk about at some point. And then booking an extra 10 minutes per day, that can be, it's somewhat of a gain there, but I think the more you can expand the schedule, you can do different things with the time that you have already, it's going to make a big difference. And then the average cancellation rate, as we just talked about, that's the biggest problem. You can see that there's a huge loss that dentists and their teams have to face there. And then one interesting point here, we're going to at some point talk about online scheduling. That's a big untapped area for a lot of practices. And we see more and more of our practice web clients getting excited about online scheduling, using our tools to do that, and seeing big gains on that. So, we're going to get into some of this in detail. Now, that was a bit about production, how other officers are doing. What else? Like, scheduling impacts even morale and patient care. So there, in general, when they do these surveys of hygienists, assistant, front officers, there are signs of burnout. There's feedback that there's burnout. And even like if we talk about just quality of work decreasing, a lot of that has to do with scheduling, because scheduling is, they feel it's outside of their control, and they're pressed for time, or whatever the case, but it's all kind of somehow related to scheduling. So it does impact morale. Now, what about the OMs out there, the practice managers, the dentists? How, if you ask them, why has your quality of work gone down, then they're going to say usually 2 things, like operational systems are outside of their control, or extra effort doesn't make a difference. They feel like that. They feel a little dejected. Dentists feel pressed for time, and 100% of those who said that their quality of work is lower than before, it's because of scheduling is outside of their control. And the dentist is saying this, the practice owner, and even if it's just an associate dentist, still, like, they should have some control over scheduling, and they don't feel like it is. So again, this is kind of like that, don't let the day run you. It's what's happening here, it seems. So then when we look at patient happiness, 30% of patients walk out when there's a long wait. So goes back to scheduling. If we have a long wait, something's wrong with the scheduling. Obviously, it's not because that's just how it has to be. It's something, the levers haven't been tuned just right to make sure that there's a minimal wait time or no wait time. Then 20% have actually considered changing or switching providers after sitting in the waiting room for a long time. There's a lot of other things here. I mean, there's 61% of patients say they have skipped going to the dentist because of how hard it is to schedule. That's tremendous, right? We don't want that. We don't want that awful experience. We need to do a systematic approach to designing our ideal procedure times. That is the building block of proper scheduling. So you need to really conduct a time study. It's not the funnest thing to do, but it's an important thing to do. And you can use multiple tools for this. We have the wiki feature in Practice Web, and so that is right here under Tools, and then you go to Wiki, and that wiki is basically anytime you want to do any internal documentation, policies, procedures, research studies, use the wiki. That's really, really helpful. It's like an internal policy handbook or anything, like for any information for your office. And the way to do it is to grab a timer, time the dentist, hygienist, and assistant, and then calculate an average of at least 10 appointments. And then once you do that study, what do we do with that information? We want to set procedure times in PracticeWeb. And now there's two ways to do this. I'm going to show you the first way right now. And you may know some of this already. But select the list menu, go to procedure codes, then choose a procedure. Let's say I'm setting a time for a crown procedure. I'm just going to go in here, and in this procedure code screen, I can set the time right here on the left side. And then also it relates to the time increments, right? So based on your time increments, you're going to have that time pattern and the different blocks there. And the X's and dashes, X means the provider time, dashes means assistant time. So figure out what that is based on your time study, and assign that to your procedures. So start baby steps. Like, let's start somewhere and at least get like the top 10 or top 20 done. And then you can work your way further if you need to. But that's basically how you set it at the procedure code level. So this will then mean whenever you schedule this procedure, it will make sure to reflect the proper time in PracticeWeb. Now, the next level strategy here is next. So here, there's a feature called, and I'm always surprised, a lot of you are not using this feature. It's very useful in some cases. So you go to setup, appointments, then appointment types. And these are basically your most common procedures in the office. You know, I've seen offices with like 20 or 30 of these. I've seen some with none, as I said. So use this. And then what you can do here is you can color code it. You can group procedures together. But the feature I like is that you can do basically a time override. So let's say you have 3 or 4 procedures. That, if you just take those 3 or 4 procedures, that might take, let's say, an hour and a half based on each procedure time. But when you create one of these appointment types, you can say, okay, when I do those 3 procedures together, it actually doesn't take an hour and a half. It takes an hour. It takes 45 minutes. So then you can create an appointment type for that and then override the time on this left side and say, okay, it's going to be 45 minutes for this appointment type, even though individually, if you stacked them, it would be an hour and a half. So this is where you can really get creative and reflect accurately what time should be allocated to each type of appointment. So that procedure time strategy is very, very critical. Here we can see, you know, obviously with the appointment types, you can make the appointment stand out, but here you can see that it'll automatically populate what provider time is needed for that. And now you can double book, triple book in the same hour, and because you know what provider time is needed. And we're going to cover that a little bit in more detail soon. Now, when can you select these appointment types? When you're creating planned appointments from the back in the clinical chart, dental chart, or the other treatment plan, or you can also add it to the schedule directly. So that's where you can do this. So that is setting your ideal procedure times. Please, I request you to do that time study. I know it's not easy, or it is tedious, but it's going to be very, very useful for you. And then now, the other piece that you need to do, this is all preparation. So next is know where you're going. What is our target? What we want to do here is use the historic figures to figure out your hourly production goal. So we're talking about setting the goal, but how do we even know what that goal should be? That's always the first difficult step. So you go to the reports section of PracticeWeb, then you click on, you can click on monthly production goal, or you can even click on your regular production income report. But in this case, we're showing the production goal report. And there you will choose your dates and providers. So let's say you choose last year if you want, take 2021. And then you'll get a long report with the production. And then the last page will show you your totals. So that's where you want to look at what you did. Now, you can use these totals to set a goal. For example, like I want to have a 2% gain or a 5% gain or 10% gain, whatever your ambition is there. And this should be a conversation the dentist owners has with the office manager and whoever else are on the management team and anyone else they want to really involve. So, that's option 1, is look at your own production history and then figure out an annual goal. And then the second option is going to be looking at the models that are out there, the information that we can gather. So for a solo dentist, an okay or low goal might be around $1 million a year of production. The ideal might be for a single dentist, solo dentist, of 1.2 million, and the upper echelon would be 1.8 annually. And you can see how it kind of breaks down all the way to hourly. So obviously, in option one as well, if you're looking at your own production numbers, you have to go back and look at hourly, kind of figure out what the hourly number is from the annual number. But here is some data that's gathered by MGE to talk about this. Now, the hygienist side of things, it's you have a similar breakdown. So you have 312,000 per hygienist, then maybe 420 as ideal, and then a little over $500,000 for the upper echelon, and what the hourly production goal should be there. So again, you can look at market studies, or you can look at your own and maybe do a combination. Hey, here's where we are. Here's where maybe we should be based on market studies, but we can't get there overnight. Let's try to do 2, 3, 5, 6%. This is just more of an emotional idea, but employees who believe they are trusted by their managers and CEOs can better see the big picture and tend to be more loyal and productive, or in other words, more engaged. So again, if they feel like ownership, okay, here's what we're trying to get to, and I have a very important hand in that, I'm going to get it done. So you see an increase there on all business metrics. There's outperformance, and then the actual companies who share information has gone up over time. From 2012 to now, it's a huge difference. So I think people are getting hip to this. But when you do figure out that hourly goal based on those studies, you want to basically then use this production goal feature in PracticeWeb. So what you can do is set that up, and I'm going to talk about that a little bit, but then you'll see that everyone will see that on the schedule, and they know where we are, where we need to be. Okay, I got to fill this thing up more. I have to maybe move some things around. We don't want inconsistent days. I think that's the challenge. Is maybe one day you're like rocking it, and the next day it's like crickets, right? So we don't want that. We want consistency, and that's going to be done partly by this goal setting. Now, how do we do this? So first, make sure your schedule is set up properly for all the providers. Once you set up the schedule, you set that hourly production goal. You go to the provider setup screen. I think it's under lists and then providers, and then that's where you will go to edit the provider and set that hourly production goal. And the system is going to multiply this number times the number of hours you are scheduled in that particular day based on your practice schedule, and automatically show that number, as I just showed in a few slides ago, where it shows the goal and where you are. So goal will show up there. And then you can actually check that. We're going to talk about reporting later on. Now, you can also create views. So you can actually create views. Let me see if it's over here. So you can actually create views and what happens there is the views will determine what the goal shows you. So you can actually look at it from different views and see what the goals are for that particular, let's say the hygienist only, or the doctor only, or this doctor, that doctor. You can kind of isolate goals by provider and set up a view for each provider. Now, we're going to get into kind of a second area here. So we talk about goal setting, and this is kind of related to goal setting. How do we actually achieve that goal, right? Let's look at it like what is the mix of treatment that will help us attain those goals that we have, right? So we're going from the very broad, which is the annual production goal based on your history as well as market research, and then we whittled it down to the hourly. So that's the calculation you need to do. And then now we're saying, okay, we have the hourly goal, which is going to also show a daily goal on the schedule. How do we hit that? What treatment mix do I need? Now, this is going to be varying a lot from office to office in terms of what you specialize in, what your focus might be. But we're going to show you some examples here. So a very common strategy that a lot of offices use is breaking it down into primary, secondary, and tertiary. So for example, primary, you might have all your big ticket items, right? Crown, veneers, full denture, implant, and that will be your primary bucket, which you need to decide what is in that bucket. And again, the 1,000 plus is just our number. You can have a different number there, but have a primary bucket. And you have a secondary bucket, which is going to show things like exams, the composite fillings, and certain types of veneers there. So that will be like your secondary. And then tertiary, it's all the things that are like non-billable, non-chargeable, post-op, recheck adjustments, try-ins, evaluations of some sort. So you will have this sort of non-billable section, tertiary. Now, let's say you have a daily goal of 4,600. There's different ways to reach your goal. And again, all the multi-million-dollar practices, that's the topic of this webinar, are using goals. They're not just going in the dark. So that's why we're getting into the nitty-gritty of this. So let's say you have a daily goal of 4,600. How do we hit that? Well, one thing is you could have an implant every single day, and again, these are just examples. Your goal may be much higher. You might need multiple implants, but as an example, maybe one major procedure that's a big ticket item, or maybe you have 5 crowns. That's 5,500 production, or you might have a bunch of small things like 19 two-surface composites in a day. Obviously, very tricky to get that done in a day for one dentist. The ideal scenario is going to be doing the mix, right? So let's say in this case we did 3 PFMs and 6 two-surface composites. You're going to hit the 4,800. So the normal approach would be here that the dentist is going to need to target, let's say 2 to 3, in this case 2 to 3 primary procedures, and then you'll have 5 to 6 secondary procedures, right? Your mix might be different, but having that mix itself is useful because it's going to allow more consistency and more likelihood you're going to hit the target. Now, how do we actually set the stage for this, right? So we figured out here's what we need to do. How do we set the stage? Well, one big thing I want to make a point is going from 15-minute increment to 10-minute increment. There have been studies showing that you gain 7 days per year. So you can have, a huge gain just by changing your increments of how you're scheduling, right? From 15-minute to 10-minute. So, we want to encourage you to think about this. So now, we're not saying you have to go from 15 to 10, but just think about this because there is a big gain that can be made there in terms of production and also scheduling. Now, what we need to do in terms of templating, I'm going to start to get into this topic of templating. So we want to identify 70 to 75% of your production needs. So whatever your daily goal is, identify 70, 75%. And that means, let's say, we're talking about, in this scenario that I gave earlier, just those 3 major procedures, right? So that's about 72%. So the reason I'm getting into this is because you don't have to template out your entire day to hit your goal, because if you template out about 70 to 75% of your production needs, the rest will take care of itself. We want to keep the flexibility in our schedule and still use templating, not no templating versus all templating, right? So if you're gonna, look at that 72%, which is basically the primary procedures, if we hit those, we are on track. We're gonna fill up the rest of it. We're gonna hit the rest of it. So when you're templating, consider, okay, where do I want to now put that primary procedure time block or block out? Where do I want to put that on my schedule? First of all, here are some criteria. What time slots are harder to fill? Let's template that, because that will laser focus our team on getting that stuff filled when I'm scheduling with patients. Number 2, when does a doctor work best? When do they want to work on these types of procedures? So ask them. Number 3, what portions of the visit can an assistant handle? Number 4, should I stagger between operatories, right? That might be a good idea. And then number 5 is what pace does your team work best at? So, again, 3 crowns gets me at 72% of that 4,800 goal. That's, again, these are just sample numbers and sample procedures, but that's why you don't have to template out your whole day. Now, there's going to be more templating I'm going to cover here for other reasons, but for hitting your goal, you don't need to template out everything. Now, blockouts, as I alluded to, we want to use blockouts here. So set up your blockout types using definitions. the definition screen under setup, set up your blockout types. Then once you do that, right click on where you want to add that blockout for templating on your schedule and add those blockouts as you need to. And then, here's the example of when you click that, you'll then pick the blockout and which operatories, and then template out your day. Now, here you can see that we have 3 primary blockouts that represents about 72% of our production goal. We've put them in the middle of the day because that's usually harder to book in this scenario. We've also added a do not schedule block besides them because we want to know that the doctor will be available for that, the crown procedures, etc., and they can't see other patients at that time. That could be a strategy, or you can think about maybe if the doctor doesn't need to be in there the entire time, but usually they do for those kind of procedures, then you might be able to be flexible there. Now, the noon blockout is extending into the doctor's lunch. You can see that there a little bit because he'll be finished with his part at 1, and then the assistant can take over making the temporary crown. This is why our 11 and 12 appointments overlap as well. Now, if this looks good to us, we're going to block out, cut, copy, paste, and duplicate the day and repeat it throughout the week. And then we'll copy the week and repeat it, let's say 26 times to cover the next 6 months. So 26 weeks, right? So that's block out, cut, copy, paste. You can just do that, copy the day, and as I said, once you copy the day, you create the week, and then you copy the week. So it's kind of like you create your ideal day, and obviously every day could be create your ideal week, essentially, because Monday might be different than Tuesday, which is different than Wednesday. So create your ideal week, and you can, if 2 days are the same, you can do the copy day into the next, let's say Monday into Tuesday, and then once you create your ideal week, now it's really easy. You just copy the week into 26 times, repeat 26 times. Now we have a whole tutorial on this, so that'll be in the email, but it's called, you can just look up blockouts on our YouTube and you'll find it. So the other thing here, besides the production blockouts, we also want to block out for essential or lengthy appointments. So for example, new patient, we want to have new patients, at least people talk about 1.5 per day is ideal for a solo doctor. You have to figure out what it is for your new patient goals, etc. But that'll be something you want to make sure does not get missed. So you have that consistent days, and then you might have limited emergency exams, and then something like an SRP where it might take an hour, 90 minutes. It's hard to schedule that. Let's do a blockout for that too. So this is the other type of templating you should mix in there. And so another thing you can notice here, so on the hygiene side, well, actually, let me start on the doctor side. So the new patient appointment, in this example, we did it at the beginning of the day because maybe patients want to get that first appointment of the day, or there could be reasons why we want it at that specific time. And then we have a couple blocks for limited exams for the doctor. On the hygiene side, we're doing assisted hygiene in the morning. So the first 30 minutes is blocked out in one operatory for proper staggering. So that means, like, you see the do not schedule there at the top right. So there's some stuff happening there. Now, the doctor's operatory stayed open at lunch in case there are appointments an assistant can take, like whitening deliveries, reseating temporaries, sealants. But the hygienist is blocked out completely. We can see that at the lunchtime. And then after lunch, the second operatory is closed off because the hygienist might be doing that SRP, ideally, right? So we're blocking off that second operatory. If it doesn't fill, we can always, book perio in the afternoon or revert to prophies and stagger them again. So there's some things we can do here. And you can see from this example how important it is to figure out your exact mix, right? It's different for every office of how to stagger things, etc. Now, the other thing I just want a quick plug is that, because we're talking about operatories and operatories, time is limited, right? So if you get into teledentistry, we offer an option for this with Practice Web. It's very low cost. This can help because sometimes patients don't really need a chair. You can keep chairs open by performing virtual smile consultants. Again, multi-million-dollar practices are doing these kind of things now in 2022. So you can do virtual smile consultations. If a patient has already had x-rays, it could send them to you. You can do some second opinion visits virtually. Obviously, if you're prescribing something, you may need to see a patient in office, but you can do a lot of consultations this way, and that'll keep your operatories open, which means you can get more production on your operatories. Now, we want to be prepared to prevent cancellations and fill gaps, and just overall, be ready to maximize our production. So, number one is maintain lists. We're gonna talk about this more, but as an introductory point, maintain lists, which are called the appointment list in Practice Web, and then you can. There's a video called the ASAP list, for example. Like that's a big one to maintain, but there's a lot of appointment lists that we're going to cover in a moment. Have a written cancellation policy. So people with a history of cancellations should not get prime spots on your schedule. The way you can figure out if they are a problem patient with cancellations, you can check either the patient dashboard, which can be added to Practice Web. It's a feature you already have, or you can check the patient appointments list in Practice Web, which is in the top left corner of your schedule. You'll see the appointments list for any patient you've selected, and you can see their history. How many times have they missed, canceled? And that's why it's also important to mark your appointments properly. When they cancel, use the right click right click, and then mark it properly. Is it missed? What is it? Are we rescheduling this thing? And so just check, right? And then lastly, one person should be in charge. And for bigger offices, it could be more than one person. But in this sense, we're talking about management, right? So one person should be, even if you have 3 people scheduling, there should be kind of one person guiding it. It could be the office manager, it could be someone else, a scheduling coordinator. But let's have one person responsible, but everyone who touches a schedule should be trained on your protocols that we're discussing here. Now, how do we get into filling the schedule, right? A lot of you mentioned that that's one of your challenges, and we also saw that in the ADA report at the very beginning. So check if a provider is available with time bars. Now, again, we want to maximize, right? So we're going to talk about time bars now because that's a really great way to maximize within multiple operatories. You have the provider time bars, the appointment time bar, and then you have the operatory time bar. The provider time bar is like when they're available, essentially. Appointment time bar is for that appointment, what is the mix of dentist time versus assistant time, and then we have the operatory time bar. Now, what we can see is that the provider, when the provider is double booked, it's going to actually show that. So in this example, we can see the hash right there, the hashing that's happened with the black and blue. That's because someone has accidentally double booked this. Now, when I say double book, there's a double book, which means you can't be in the same place at 2 times at the same time, right? 2 places at the same time. But you can stagger it, right? So if the first 30 minutes the provider is there, and the next in one operatory, next 30 minutes in another operatory, now you're using that hour wisely, but you don't want to literally double book because that's going to cause problems. That's what this is warning you about here in that red circle. So this is going to also help. So now one thing is, let's make sure we're maximizing that hour, but let's also avoid this situation. Going back to ideal procedure times, that's where, if you remember, there's those X's and dashes. So make sure you are doing that properly. So dentist time in an appointment, figuring that out is very, very important so that you can do this, what we're showing here. Now, when we get to actually scheduling, there's ways to phrase things that are very useful for you. Rather than saying what would work for you, I think a lot of you may know this or try to do this, but it bears repeating that don't say when are you able to come in. In fact, I just called the dentist today before this webinar, and that's exactly what they asked me. When are you available? They didn't ask me specific times, and that tells me they're maybe not templating the way we're talking about. But and maybe they are. Maybe you can ask that, but then it becomes kind of a cat and mouse game. But if you ask them and then that doesn't fit your thing, and so maybe giving them some options is useful. And you can look at their appointment history and see when they usually like to come in, and maybe there's some notes you've put in about that for the patient in Practice Web. So how does tomorrow at 1 or Thursday at 10 sound? For recare, you can do something like, how does the same day and time 6 months from now work for you? And here's what that day and time is, because that'll be likely good for them. Another thing is you can say, if if they're opposed to scheduling something, it's always a good idea to say, we booked so far in advance, I'd hate for you to have trouble getting in. Let's just find a spot that you think will work. We're not trying to cram it in without them agreeing to it, but let's find a spot you think will work, and we can always change it later. Let's just give us a couple days notice. At least that way you got 50% of the way there, right? Hopefully they'll, come up to that appointment, but you have confirmations and stuff. So there's ways to prevent cancellations on the back end, but on the front end, let's get that thing scheduled. So reframing is important. Now, by the way, each one of these points can be a whole hour webinar. I'm just breezing through all these points, but that itself about how to phrase things is a webinar on its own. Now, perform follow-ups, okay? So a lot of times we do this when we feel like it, right? Oh, we haven't looked at our recall list in a while. Let's go take a look at that. No, let's have it systemized. So let's have a protocol. Here's an example. So every month we're going to check our recall list for whoever's overdue 1 to 6 months. Every 2 months, we're going to check whoever's due 6 to 12 months. Every 3 months, every quarter, we're going to check who's due 12 to 18 months. And every, maybe every 6 months, every 4 months, you go and look at who's due more than 18 months. And then there's ways to kind of inch them back to your office. You can be dramatic and say, we're inactivating you, or you can be a little bit softer and say, we're concerned about your oral health. We haven't seen you. And I think whenever you make it about their oral health, it's always a good strategy. So we're concerned about your oral health, and we hope that you're at least seeing some dentists, but if you're not, we would love to have you come back in, right? So just that caring, concerning approach is a good thing for the reactivation. Now we have a lot of other appointment lists I'm going to cover, but just focusing on recall, one great thing you can do in our recall list is generate your list, first of all, based on the date range we just talked about, the different date ranges, but then use the text messaging, because that will help you do a mass text with literally like 2 clicks. And you can just send out a text message that you customize to get those people in the door. Now, if you're using online scheduling, I'm going to mention later, you can actually put in an online scheduling link right here. And that's amazing. That we've seen wonders with other clients when they do that. They get a lot of appointments and production from that. So use the mass texting feature, and you can get that with PW Connect. Now, another nice feature we have in our texting is that you have automated recall reminders. So what I talked about recall, this is like adding another assistant or another front office, because every week it's going to check automatically who's due for recall and make sure those reminders are going out. And you can set everything like how many reminders should they get total, et cetera, et cetera. So there's a lot of customized. These are automated recall reminders by text. Now, other lists and things that you should be following up on. Plan tracker, check that every month. Those are the planned appointments. First of all, you have to use that. So that means when you're treatment planning something in the operatory, don't just treatment plan it, plan out the appointment itself so it gets on your plan tracker. That does 2 things. It helps your front office when the patient is checking out. It will help the front office say, okay, looks like this is what the doctor wants to schedule. I see a note here as well. Let me just get that scheduled. So you can directly schedule a planned appointment that's created in the dental chart in the front. Now, if you've created that, the other good thing here is, let's say the patient is not ready to schedule. You can't convince them, whatever's happening there. Now you can go back every month and check that plan tracker list and get those people scheduled. And you can send out a custom text message to them as well, right? Same deal, text message. There it is. You have some important dental treatment that needs to be completed. You can customize the message to your liking. The other area would be unscheduled lists. These are the appointments that need to be followed up on. They may have canceled, not showed up. You put them on the unscheduled list, and we want to get them scheduled. Once a month, at least check that. Then you have, and now it's kind of like the time when hopefully you've already done this, but if not, maybe you can still do it. Do the year-end benefit reminders, New Year benefit. So there's a New Year benefit reminder too that you could do in January. But there's all kinds of things you can do with the treatment plan manager. There's also a treatment finder report, and that has texting built in too. And that's somewhere where you can, hey, you have this treatment, you have these benefits. Let's make sure you don't leave insurance money on the table. That can actually be your text message. And that will, if I got a text like that and I know I'm leaving money on the table, I'm going to respond. So use that functionality there. these are ways to fill your schedule, right? And so online scheduling is another big thing. Just going to briefly address this, but you can see all the amazing things here. So number one, 77% of patients prefer online scheduling. 60% of all appointments are scheduled online today. And then 15, wait, maybe I missed that. Oh, sorry, all appointments. So Jen, I think that's referring to all industries, right? Is that what you're talking about there?
Yeah, because there's a disconnect. A lot of offices aren't offering online scheduling right now. And so that's a problem since patients want it, and it opens up doors for them and boosts their production in a big way. It makes them more marketable.
Got it. So yeah, I mean, this is the main point here is patients want this, and the practices that are offering it, that's who's going to get the worm, right? That bird is going to get the worm, not you if you're not offering this. So it's becoming very competitive, and you need to have online scheduling. It's not like a need to a nice to have anymore. It's a need to have. So 15% of all dental appointments are scheduled online today. And that just means that, look, that means not enough people are offering it. That's why only 15%. But you can see the disconnect between how many patients actually want it versus how many are actually doing it, because the dentists are not offering it. So whenever you see that, by the way, a majority of people want something, but only a few vendors are giving it, or a few companies are giving it, that's where you get in, right? That's where you can distinguish yourself and boost production. So 44% of patients would choose a dentist. So if they have dentist A and dentist B, one of them offers online scheduling, a lot of them are gonna go with that dentist. And the reason is, there's many reasons. Number one, 37% of appointments are scheduled after hours because everyone's busy during the day. You're working, guess what? They're working too. So they don't have time to call during business hours when you're available. So 37% are after hours. And then even if you do it during business hours, people are on the go. That means they're just busy. They're not really thinking. And that's where you get the cancellations, right? By the way, I don't see a stat here on this, but it's been proven that people who schedule online are much less likely to cancel or no-show than someone who cancels schedules over the phone, because they are able to pick exactly the day and time they want. And that's based on your online scheduling, which you can customize, by the way. You can decide what to present or what not to present online. And then finally, you save a lot of time for the patient and for you, and that's why they like it. That's why you like it as well. Now, there's a whole webinar on this. I'm not going to go through how online scheduling works, but essentially they can choose their time slots. They can then also fill out their forms online. So there's a whole webinar called Online Scheduling. Check that out, and that'll go into detail. Now, when you have an online scheduling link, you can use that in your marketing. So in your newsletters, in your promos, in your recall due reminders, as I said earlier, you can customize all those text messages to include the online scheduling link. You can have marketing texts that go out, promos, dental cleaning specials. There's just, the list goes on, plan treatment list, your year-end list, like all these things can be turbocharged. Your social media with the online scheduling, social media, your website, review sites, Google. So it's all over. Now, what are other things to keep your schedule? Now, we try to fill it. Now, how do we keep it full, right? Filling is one thing. Keeping it full, making sure there's no bleeding out there is the other thing. So let's have a robust reminder strategy. Here's an example of one, but yours can be different. 6 months before, let's say, this is an example of like a hygiene recare. So 6 months before, they get a save the date. That save the date text that we provide is at any time. So even if you schedule something that's 2 weeks from now, they'll still get the save the date. Whenever they schedule, they get it. But save the date could be, you might be doing a card that you hand out to patients. You might be doing an email. We have a texting option, which is the most effective. So that's number one. Number two, let's say 4 weeks before, if they schedule hygiene recare, they get an initial reminder. It could be a text, like with ours, email, phone call, whatever you want to do. 7 days before, confirmation of some sort. We have texting, automated. And then lastly is going to be a final reminder. If you're doing these 4 things, you will drastically reduce your cancellations and no-shows, which is the biggest problem. PW Connect, here you can see that we have all these things: save the date text, confirmation text, reminder text, recall text. That's the name of the game, is texting and email. We also do email. Now, if you do that, let me actually go back. Yeah, if we do that, you will reduce the cancellations, but you're still going to have gaps in your schedule. So how do we keep it full? We use ASAP. And many of you may be doing this. Mark people as ASAP if they want to come in earlier. Just today, I had a conversation, like I said, with the dentist, and I said I want to come in this week. I had to reschedule something. I said I want to come this week. They didn't have anything. They didn't. I don't know if they put me on ASAP. Maybe they did. Maybe they didn't. They didn't tell me. But if I was that front office, I would have said ASAP because they want to come in earlier. But we're going to give them next week appointment. So if something breaks down on Friday, I'm calling Neil and I'm going to try to get him to come in earlier because he wanted to come in. So make sure you're systematically marking as ASAP. Whenever you hear patients saying, do you have anything this week? No, we don't. But what about next week? Are you available next week? I'm marking that as ASAP, right? And that's the list that we want to look at, as we said, and contact them as soon as openings happen. You can send a text message and just say, hey, we have an opening at this time. Would you like to come in? And first person gets the slot, right? Whoever responds. Now, this is an interesting strategy. There's some of the multi-million-dollar practices do this. They double book a patient when there's a history of cancellations and or they don't confirm. Now, this could be your policy. If you do not confirm, we will double book you and you may have a longer wait. So what happens if they come in? If they come in, you try to squeeze them in, right? You don't want to like turn them away, but you got to tell them in your policies, right? In the forms they sign, in your confirmation text message, you can say, if you do not confirm, we may double book this slot to ensure that, patients get the care they need. Something, you can be creative there, but this is a controversial yet useful strategy that some offices are doing and they're very successful with it. Now, let's do a morning huddle as well. So let's discuss during our morning huddle a couple things. Number one, are there any patients scheduled on the doctor's side that need to get hygiene appointments, right? Is there anyone that needs to come over for hygiene? They're coming in for an emergency, but they need hygiene. Patients on the hygiene side who might need treatment, right? They're coming in for the regular care, but they haven't scheduled that outstanding treatment that they need. Let's discuss that and try to get that taken care of. And then thirdly, are there family members of patients who are already coming in who need appointments and treatment? Let's get them scheduled, if not come in the same day as the other family member. Now, there might be issues to discuss too. Who might no-show or cancel that has a history? Are there appointments that might run long? Are there appointments that could be potentially double booked because they're quicker than we thought? Are there times when an assistant or hygienist might need an extra hand, and who's available to help, right? So there's gaps and there's issues. These should all be discussed in the morning huddle, if possible. Now, last kind of strategy here is track and improve. So what can we do here? We can monitor in real time, as we talked about, with a daily production and daily goal. By the way, I know I'm covering a lot of strategies and things here. If you need any help, call support. I'm going to say it at the end, but I'll say it now as well. So this is one way to track it in real time, daily production and daily goal, if we're on track. Number two is let's look at our reports in a very strategic way. Monthly production goal report is a great one, especially if you're starting to now use the production goal feature. Reevaluate it every 6. You can't stay stagnant here. So 6 to 12 months. If you're meeting goals, increase your targets. If you're missing goals, find out why. The why could be things like our treatment mix is off, right? We talked about earlier the treatment mix. Maybe we're doing too many secondary, not enough primary. How can we fix that? Maybe there's, we're not filling our schedule efficiently enough. And we need to do those strategies better. Maybe there's an inefficient clinical flow leading to longer appointments. Why are we missing goals? And then if you're working faster than you thought, do another time study. Or if you already have a hunch about that, you can reduce your appointment times, and that will really help in a big way. Now, those are all the things we wanted to cover today. I want to cover your next steps here. Very, very important. Now, if you're ready to implement these strategies, call our support team, option 2, and let's get you the help that you need to implement them. You can also, if you have support questions, you can also go to the help menu, click on remote support, and then fill out the form there, and we'll help you out. Follow us on social media, continue to connect, and you'll get a lot of great content for helping your practice thrive. I think there's amazing content on this one. So review it with your team, then have a real discussion of, okay, here's what we're already doing. Here's what we should be doing. Here are the steps that Neil talked about. let's set a goal. By next 2 weeks, we're going to do X, Y, Z, and start this protocol, start this process, do the time study, do this, do that. Have a constructive conversation. Don't just make it like, watching material. We want to make it, implementation material. So I want to lastly say, as I always do, you've got this. You can do this. We can all hit the promised land, multi-million-dollar practice, and that's going to benefit everyone on our team. It's also going to benefit ultimately the patient, more patients getting more care that they need, and let's get it done, right? Thank you very much for spending your day and your time with me, and we look forward to having more great conversations going forward, including next month. We have a great webinar planned, so we'll send you some information on that. Thank you, everyone, and have a great rest of the day. Goodbye.